I just want to welcome everybody. My name is Susan Anderson. Um, I'm doing a webinar today on account specifics. I will be recording this. Hopefully, we won't have any technical difficulties, and this will be on the forum for you guys later on. Let's admit Sue. Okay. Okay, so I'll be taking questions at the end if possible, if there's time. So you guys just hold your questions till the end if possible. Um, so today I'm going to be talking about account specifics, and I know that this is not the most exciting topic in the world or glamorous. We know that, but it is a very important topic, and I get a lot of questions all the time about, you know, excuse me, I do have a little bit of a cough. Um, how do I know when to make a heading? Or I've made a heading, but I was marked wrong. Or I did it this way, but I, you know, it didn't. I did. When do I make a paragraph? How do I know when to number? When do I capitalize a department? How do I know when to leave a blank? How do I flag something? I wish I had a set of rules to go by. Um, Some students want to know where to find the account specifics after they have completed PI 1. I've had students ask me some of these questions after they have completed PI 2, and even some into their practicum. I think the sooner the students gain an understanding of these rules, the better off you're going to be. Focus can then be put on where it needs to be put on, and that's actually what the doctor is saying. You can develop your listening skills and do your researching skills. Account specifics are important. They do matter, and they're put in place for reasons. I know y'all don't think there are, but they are. And hold on just one second here. And doctors and hospitals, they want their reports to be transcribed or edited the way they want it, period. And that should be enough because they're paying your bills. They're your bosses. And, you know, when you're working for a company, like right now, if you have jobs, you follow a set of rules. So that should be good enough. They're paying you and you follow rules wherever you work. So sometimes there are insurance reasons, billing reasons, there are, uh, you know, for certain words being used, for certain headings. One time I had to, where I was working, I had to, every time that the doctor said physical therapy, I had to type in rehabilitation, and it was for billing purposes. We don't have to understand the reasons behind why they want the, you know, rules the way they want them. They're our bosses, and we should follow their rules. Basically, they want their reports to follow the same pattern and to be uniform. So account specifics, you start following those rules when you get to the body as a whole dictations. And excuse me, I'm so sorry. These, excuse me, these account specific errors are called protocol failures. And these are costly errors at 1.5 points apiece. And they can add up really very quickly. Punctuation errors, they're a quarter of a point. Protocol errors are 1.5. So many students focus on commas so much, and while punctuation is very important, I would love for you guys to put it all in perspective. We only take off for the same type of exact error only once per report. That means that you could have 6 entirely different punctuation errors that would add up to make just one protocol error. So let's do the math. Okay, so if you have a report starts with, of course, 100 points, and you have, say, let's you have 6 protocol errors. That leaves you with 91, and that is without any other error whatsoever. If you have a a report with 6 punctuation errors, then you could have a 98.5. Now you have to factor in any other errors that you might have, of course, but I would rather start out with a 98.5 than a 91. I mean, where should your focus be? I would say with the more costly errors. Plus, your report is going to be formatted, excuse me, incorrectly with all those protocol failures. And if you're working for when you're working somewhere, a doctor is going to notice those protocol errors a lot more and be more upset than some comma errors. And punctuation is important. I'm not knocking punctuation, but really, let's look at the math. If you're shooting for high honors, and I hope you all are, there are about 58 instructor graded reports, and that's including pi and everything else. Look at that. If you had, say, 4 errors per average per report, 99 comma errors or punctuation errors versus 94 with protocol errors. I think, time is more well spent learning your account-specific errors early on. Excuse me. Now, we get so many calls about punctuation, and when these other errors are being made that really bring your grades down. We see a sea of green and so many big errors, like, that cost so many points. And then, you won't understand the comma. And listen, I have made webinars on commas. So I am all about punctuation too, and they are important. They can change the meaning of sentences, and I'm all about that. But I'm about grades and accuracy and formatting and important things too. And when you continue to make these errors throughout your course, these are the type of things that really bring your grade down. So it just makes really good mathematical sense to me to focus on the way to make the highest grade. So for those of you who are worried about your punctuation, and I know you all are, this is what I say to do. This is my best advice. Go to your punctuation preamble, and you can always find it by going to your FAQ section, type in the word punctuation, and excuse me, and you can see that you can pull it up like that. There will be a list there, and once you do that, go and take that first one. This is the one that we take off for, okay? 622, that's the first one on the list. Now, go to that book of style rule, look it up, make a notebook for yourself. List the rule, list the example that they give, and then make your own example. And then every day or two, make a new sentence for yourself and make it make sense to you. And when you stop making that error and you feel like you've really learned it, you've understand it, and you're applying it in your work, then move on to the next one. You will have plenty of time throughout this course if you truly focus on one rule at a time. And I think it's easier to learn one punctuation rule at a time. Knock it out. Actually, I don't know how many. I think they're 10, but there may be a little bit more. But that's the best way to do it, I think. I think if you know your account-specific rules, it makes everything less chaotic. You know when to make a heading, when not to, when to stack the physical exam, when not to, and you get it. So focus on the big stuff, the big points, and then work your way into those rules one by one for those commas and punctuation and the hyphens and things like that. So again, let's stress where we go to, the first thing we go to here for the hierarchy for transcribing for CanScribe. It says, when verifying information, you must follow the hierarchy in the order listed below. Account specifics, number 1 on that list. And I have so many students that say, well, I found this in the book of style. I found this in the book of style. And I have to say, I'm sorry, but account specifics first. If you can find it in the account specifics, that's where you need to apply the rule. That's where the rule comes from. Okay, so we're going to go through, and I will say this, where you can find, let's talk about where to find your account specifics. If you don't know, There's a link at the top of every single report that once you have submitted it at the left, and it can be found also in your facts section. And once in the account specifics there, you can use the Control F feature to search for words, which makes it super easy when you go, I don't know how to make a heading. Well, you can search for the word keyword heading or diagnosis or anything like that. And this is just an easy way to go straight to it. I would suggest don't add the S to anything or make it plural because it limits the findings, the search results. But, you know, and then this one brings up 21 results. Then find the one that makes the sense, that fits the rule that you're looking for, that has the information. Until you get used to it, a lot of students print out the account specifics. But I think this is easy. You use that Control F and you have it's just right there to look up, you know, anything that you want to look up. Okay. Excuse me. I'm so sorry. Catching a little cold. Okay. So we're going to look at some dictations today, some transcriptions, and I'm going to read some for you, and then I'm going to show how maybe somebody might have transcribed them with some errors in them. And I want you guys, we're not going to be looking at, I don't want you to write in any, sorry about that. I don't want you to write in any answers, but I just want you to keep a log of how many you find like on a piece of paper, you know, just for yourself. See how many you find, and see if you're I'm sorry, adding people. Okay. All right. So, and again, I'm not going to try to do any strange accents or anything. I already have a bit of a Southern accent, and I'm not really good at doing any other kind of accents, so I'm not going to try to pull that off. So, okay, let's get started. So, date is, okay. Okay, date 3rd of November. 89-year-old patient came in having a questionable rash. He was started on a new medication recently. He said he doesn't think he has any other new symptoms. Plan is the patient will have 2 days of a trial off the med. Okay, and this transcription was date 3rd of November. Okay, again, y'all just kind of keep up with how many account-specific errors you think you see. 89-year-old patient came in having a questionable rash. He was started on a new medication recently. He said he doesn't think he has any other new symptoms. The patient will have 2 days of a trial off the medication. Okay, let's just get started. Right off the bat, we see that date is not written in lowercase, or it's all major headings will be typed in all caps. No colon will be used. So that's number 1. I hope everybody got that. The second one, we don't use ordinals unless it's a standalone. And this is not a standalone. It comes with a month. If you said the patient was seen on the 3rd and there was no month given, then you would use the ordinal. Otherwise, we don't use the ordinal here. I'm so sorry. 89-year-old patient came in having questionable rash. Okay. You guys, I see this all the time. This is a 1.5 deduction, and I just hate to deduct for this. I really do. But you do not start a sentence with a number. I mean, there are exceptions, but an 89-year-old, all you have to do is add an before that. But for that one little word there, we have to take off 1.5 points. And that hurts. We want that number to stand out, but we don't want to spell it out. You know, that's a long number to spell out. And we cannot start a sentence with a number. So do not, y'all just please make a note of that. It happens so often. Now, there are a couple of exceptions, you know that, to every rule just about. So if it's a quantity and a unit of measure immediately following a heading, then you can use the number. Like if it, a lot of times in op notes, you'll see blood loss, 10 cc's or whatever, 10 milligrams or milliliters. That's perfectly fine. You can't use it as a sentence, though. If that was HPI, 89-year-old male, that whatever, it's not a unit of measure or quantity like that. That's, even though it's an age, that's not a unit of measure or quantity. So don't do that. And especially with sentences, even if like that started a sentence like estimated blood loss, 10 milliliters was lost from, or were lost from, whatever. If it's a sentence, you cannot do that. You'd want to recast that, okay? Next thing, contractions. Okay, so you can always do a control F and look up contraction. These are not used in medical transcription except in a direct quote. Now, I'm so sorry. Anyway, this is not a direct quote. Okay, let's talk about what makes a direct quote. I, first person, I. That's a direct quote. If they say it in this way, the patient says, unless the doctor says quote unquote, then if he says the patient says he can't quote unquote stomach something or another like that, then you would quote that. But that's not a contraction here. The patient said, I can't eat. That's a direct quote. That's first person. So you leave that contraction there. The patient said he can't eat. That's third person. That's not a direct quote. So you do not put quotation marks and you spell out cannot. So just remember, first person, third person changes everything. And that way you either leave the contraction or you spell it out. Okay, plan. Now, if a verb is dictated, it's a sentence, not a heading, unless it's in the diagnosis, impression, and assessment sections. Plan is the patient will have 2 days of whatever. Okay, so even though this is a little oddly stated, it doesn't matter. We have to be as verbatim as possible. And plan is a verb. I mean, that's a sentence right there. Plan is the patient. Next, all numbers will be typed in Arabic format, even those below 10. Okay, so we do not spell out 2. We do, however, spell out 1 if it is used as a pronoun. Now, when is 1 used as a pronoun? Basically, a good way to tell is if a noun follows it, it's being used as an adjective, and you want it's basically telling you is how many, or it's describing. So you would use the number. If not, if there's no noun following it, then it is being used as a pronoun or a noun, and you will spell it out. I like that one. She will be the one. An article comes before a noun. She will be the one with the other one. At one time, one suture, one episode, one report. Those are all being used as adjectives, and you use the number. This is all in your account specifics for you guys. So the last thing, don't expand abbreviated or short forms just in regular text. Your account specifics say abbreviations that represent diseases should be transcribed as dictated. Well, med is not a disease, so you do not want to spell that out. Again, that is another 1.5 points for spelling that out. And the dictator said med. Okay, so that is 1, 2, 3, 4, 5, 6, 7 for an 89.5. And if that doesn't count if anybody spelled anything wrong, or that's just a short little piece of that report. And it adds up. It really does add up. And if you consistently make these account specific errors on every report, like if you make 3 or 4 of these, I promise you, these are going to bring your grade down consistently over the year. Okay, I hope you guys got all of those. Okay, I know you feel like we say, don't do this, do this, don't do this, do this, do it this way, don't do that. I know it feels like that to you guys, but it's more about finding that confidence of knowing how to format and how to transcribe each report. Let's do another one. Okay, so date is 11/04/17. Pre-op diagnosis is abdominal hernia. Post-op diagnosis is the same. Surgeon is Dr. Name, scrubbed. Details of the procedure include the patient presented to the operating room. A, can't tell what was said, was taken. Okay, and this was transcribed as date is 11/4/17. Preoperative diagnosis is abdominal hernia. Postoperative diagnosis is the same. Surgeon is Dr. Name. Assistant surgeon is Dr. Name. Details of the procedure include the patient presented to the operating room. A asterisk was taken. All right, let's see. First of all, on your dates, if we transcribe verbatim as much as possible on the dates. Sometimes there's some odd ones, we know this, but this one, the example is given in the dates as if they dictate 04, then you transcribe 04. The dates in your account specifics, they give a long list of them. I mean, there are quite a few examples here, guys. So again, do a Control F, search for dates, check the examples, and if you can't find them, then you will want to leave a blank. If you can't find the exact example and you are confused about it, leave a blank. Again, if you have, if the date starts a sentence, you're going to recast it. You know, if it starts off with like 2000 May, you know, well, you'll recast that to maybe May 2000 or something. You know, you do not want to start a sentence, so there are, you know, variables in there. Also, you have to kind of consider multiple account-specific rules at one time. But there are different, there are quite a few samples given here. And we do know there are odd ones. Dictators dictate in, I mean, you know, multiple ways, and they never say things quite the same way, and we are aware of that. Try to be as verbatim as possible. Don't use ordinal numbers unless it's a standalone date, as in the patient was seen on the 7th. But if you can't find it in here and you can't figure it out, then leave a blank. You know, that's my best advice there. Okay, so now we're moving on to, again, post-op pre-op diagnosis is another it's a short form, and abbreviations and brief forms are examples HPI, PMH, post-op, pre-op, meds, exam. They're all okay. And so the account specifics say they should be transcribed as dictated in headings. You'll be surprised. I have worked for places that use all abbreviations. You just do whatever they say to do. You know, you just basically. So now, usually a diagnosis is, with the verb, if there's a verb dictated, then you will make it a heading. Not make it a heading, you will make it a sentence. But what does this say? The exceptions to this would include diagnosis, impression, assessment sections, which are always transcribed as headings. And so you're going to make that pre-op a brief form, and you're going to make diagnosis a heading because it's always made into a heading. You're going to drop the is, and you're just going to make it abdominal hernia right underneath there. Same thing goes for post-op. Post-op's fine as a brief form. Is drop, you make it because it's a diagnosis, and then you cannot use same. In an op note or in any kind of note, like any kind of diagnosis, when they say initial diagnosis, secondary diagnosis, same, anything like that, you have to transcribe the same text as you did for the pre-op or the other diagnosis. You cannot type same. That is not acceptable. So that's another 1.5 point for writing same. Details of this procedure include. Include is a verb, and that's a sentence. If a verb is dictated, it's a sentence and not a heading. So that should be just a regular sentence and not a heading. Verbs include reveal, show, were, what, was, everything. Just if you're not sure if the word is a verb, just look up the word and part of speech on Google. They'll tell you. Okay, now this is a biggie. I know that we use asterisks in our course to get your attention, you, the student, your attention. You, as a student, do not use asterisks for blanks or for flagging. You use a blank. So here it says, the appropriate way to leave a blank or flag in a report is 5 underscores. You don't need to leave anything at the bottom of a report. You don't need to leave asterisk ever, never. There's no need to ever use that in a report. I know it's confusing because you guys see it at the bottom of the reports, and we understand that, but this is the proper way for you to do it. And you need to follow this rule, or is an accounts error, specific error, excuse me. Blanks are 5 underscores, and they're used for up to 4 words. And if you think you hear more than 4 words, then leave 2 blanks. If you have a guess, leave the blank first, because if you don't leave the blank, and then you just leave the parentheses like your guess, that's a protocol error. Another 1.5. Asterisks, again, are not used by students, okay? That's just, and I know I see it a lot in the course. I see students leaving it a lot, and I know it's confusing because you guys see it from the course, but it's all in the account specifics for you guys to read. Let's talk about flagging while we're here. If you have a discrepancy, excuse me, if you have a discrepancy, right versus left, a blank. And then you just put what your discrepancy is after the blank in parentheses. Right versus left, arm versus leg, whatever. We don't know. This doctor could have, at the beginning, he or she could have said, she has pain in her right leg, we put a cast on her right arm. He could have meant, she has pain in her right arm, we put a cast on her right arm. So we don't know on that one. Now, in an example like this one, the patient's a 42-year-old male who comes in today with a painful left cyst on his left foot. I don't think I needed that left cyst there. His left foot has been bothering him for some time now. On physical exam, the patient has a cyst on his left foot that is movable. It is painful on palpation. The rest of his left foot and ankle exam is normal. And then he says, cyst, right foot. Okay, that one, you can just put, he said left, 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 and then, if he says a ton of lefts and then just one right, I think you're safe doing that one blank and then, the blank at the end and then the right. If there's just like one mention of right and one mention of left, I would flag both. But again, no asterisks, okay? It's just a blank and then your short little right or left or arm or leg or something. Doesn't have to be like a paragraph or a long process or thought, just a little blurb and then in parentheses. Okay, now there is something in our account specifics about you'll get a major deduction for the use of excessive blanks. This is just if you are going through and not trying, and we can tell usually, sometimes it's hard to tell, but and It's further on in the course. It's not to begin with. It's further on in the course after you've been trying, I mean, working at it for a while, and we feel like you could have found some of these with sufficient research. And that's that. Just wanted to point that out. So let's count these up. 1, 2, 3. Okay, that's a same error, so we don't take off for that. 4, 5, 6, 7. Oh, 5. And there are 2 duplicate errors. So 5, that's 7.5 points. Okay? Ouch, you guys. If you learn these rules, you're not going to have these types of errors, and they're not going to you're going to have so many more points to play with, Okay, so let's try another one. Well, let's talk about headings since we're here. Since we talked about it for just briefly. So if you're, I just wanted to go through a couple of examples. So major headings will be typed in all capitals, no colon, and then text will begin right after that. So don't add headings. I see this a lot too, where people go through and they'll just put in headings for everything. Physical exam, review of systems. If it's not dictated, don't add them. And again, if the verb is dictated, it's a sentence, and the exception is the diagnosis, impression, assessment. Okay, so if it says chief complaint is, it's a sentence, no heading. All of these are sentences. Reveals, showed, include, medalist is, all of these are sentences with no heading. Now, pre-op diagnosis is, drop the is, change to a heading. Initial diagnosis is, drop the is, change to a heading. My impression is. Now, some of these can be quite long when the doctor starts to talk and he can say, my impression on this patient is, or, my initial impression is on this patient, la 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 la. You can leave all that, but you still need to make a heading. So keep the text, keep it verbatim, but still make a heading. If it's just impression is, drop the is, make a heading. Okay, and also while we're here talking about diagnosis, start your description after the diagnosis, after a period. Some of the answer keys have not been changed to reflect this yet, and you'll see the difference, but we are updating them and they will reflect this very soon. So if it's the diagnosis is diabetes, under reasonable control, that describes what's going on with the diabetes, but the asthma, that's the diagnosis. And then what's going to happen, that's the description or the plan. But try to keep all of that, the description, starting after that in a new sentence. Okay? All right, so let's start another one. I hope you guys are getting a lot of these, catching them. My impression is that the patient has, number 1, CHF. The patient is worsening. Plan, I'm going to refer her to cardiology to be seen as soon as possible for a new test. She is on enalapril. I will see her back on the 3rd. And it has been transcribed as, my impression is that the patient has 1, CHF. The patient is worsening. Plan, I'm going to refer her to cardiology to be seen as soon as possible for a new test. She is already on enalapril. I will see her back on the 3rd. Okay. Well, number 1, no heading was made, so we know we just talked about that. So you can keep the my impression is that the patient has. You can keep that, but you have to make a heading. 2, a couple of things going on in this one. Lots of times, dictators will start a list at the beginning, and then that's all there is. It's just one. Speech recognition files will come in and they'll be numbered like with number 1, but there is no number 2. And then a lot of times the doctors will just start talking and they'll go number 3, number 4, and you're like, wait, what? So you have to either go back and add appropriately or delete appropriately. So you have to format it according to how many diagnoses there really are. Um, Seems so simple, but we see this all the time. Just there, it says if there's only one diagnosis, don't number, even if the doctor says there's number one. Um, and if there's more than one diagnosis, then you always make a list, no matter if they've numbered it or not. So just keep that in mind. They want the impression, diagnosis, and assessment sections. They want the heading to stand out. They want each diagnosis to have its own number, to stand out, to be on its own, so that somebody can look at it and see exactly, oh, there's the impression. There is 1, 2, 3, 4 diagnoses, and there we can look right there and see what each one is. Simple to see, simple to read, and it's right there for everybody. And then the second one on this page is did not spell out the disease. Congestive heart failure is a disease, and it should be spelled out. So let's talk about that. So COPD is a disease you want to expand, CHF, expand. Any disease you want to expand in the assessment, diagnosis, impression sections only. Unless it's a dangerous abbreviation. But do not expand lab tests, do not expand diagnostic data, and do not expand brief forms anywhere else. Just the dangerous and just the disease or disease-related entities. Okay, so the next is plan. I'm going to refer her, and major headings should be in all caps, no colon. And y'all, we see this all the time, all the time. I'm going to refer her to cardiology. Now, excuse me. Let's talk about specialties for a minute. The Book of Style says that when specialty is used as an entity, it should be capitalized. Okay, so when we use the John Smith rule, I say use any name. And it's not just, mostly it's ology. Like a specialty is ology, but it's not always. It can be like derm, nutrition. It doesn't have to always fit that mold. But if you say, I'm going to refer her to, say, Susan, to be seen, if it fits, then capitalize it. It's specialists are not capitalized, but specialties are, but not always. Here's some exceptions and some others. Okay, so the patient was seen by gastroenterology. The patient was seen by Jane. Yes, that fits. The patient will be seen with Amanda. Yes, that fits. Seen in Cameron? No. Seen at Chelsea? No. Those you cannot be seen in somebody or at somebody. But the rest of them, they all fit. Now, seen by the neurologist, specialist, unless they have scrubbed information in front of it with the name, then it's not going to be, it's going to be generic. So it's like Mountainside specialist, something like that, or gastroenterologist or something like that. Then it would be capitalized. Otherwise, it's not going to be capitalized. So, and it's departments the same way. If it doesn't have scrubbed information in front of it, then it's not going to be capitalized. It's going to be generic. It could be any emergency department. And there is some more information. And that's all in your account specifics. And then it gives you a reference for the Book of Style also. Okay, so the next thing, we kind of got a little behind there on that one, but she's already on enalapril. This is a generic drug. 1.5 points for just not taking the time to look up a drug. Medications will be taught verbatim. Don't list them if they're not dictated as a list. And then always look up the drugs. So if you go to RX list, and you can see right there, it says brand, and then right underneath it, it says generic. Even though that has a capital E on that, it's generic. And generic goes with lowercase. So it's an easy look up. Okay, I'm going to see her back on the, I will see her back on the 3rd. Again, if it's a standalone date, you're going to use an ordinal. Okay, so let's count. 1, 2, 3, 4, 5, 6, 7. Ouch. Again. I hope everybody's getting those. Okay, here's another one. Lab data, normal CBC, lipids, and LFTs. Chest x-ray showed no infiltrates. CT scan of the head was normal. Left foot x-ray showed a question of a hairline fracture on the 7th. EKG was normal. And they expanded laboratory data, normal CBC, lipids, and LFTs, chest x-ray, and they made it all one paragraph. You don't expand brief headings. You use an ordinal for standalone, and all new major sections need paragraphs. I'm kind of going through this one quickly because I just want to show you there's only 3 with duplicate errors, but you make a new paragraph for all of the each new diagnostic. And that's, you know, our account specifics say to make a new paragraph for all new major sections. And a chest x-ray is a new section, a CT is a new section, a foot x-ray is a new section. You don't lump them together. You make new sections for those. Okay, the patient has allergies to codeine and lisinopril. The patient is on no medications. Review of systems, general, no complaints. HENT, no complaints. Cardiopulmonary, no complaints. Musculoskeletal, no complaints. Physical exam showed a normal appearing female, 126 pounds. Vital signs normal. The rest of the physical exam was benign. Okay, so the patient has allergies to codeine and lisinopril. Made a new paragraph for that. Stack the physical exam, the review of systems, and you can see the rest there. Okay. First things first. Only true allergies are capitalized. So everything else, all the other words in the sentence are lowercase. And so you are going to, you know, that's a protocol error. They did well doing the allergy, the codeine and the lisinopril, but the other ones were formatted incorrectly. There's no colon after review of systems. No colon will be used. That little colon, that's 1.5 points. You know, that's a painful 1.5 points. We do not stack the review of systems. Even though there's nothing really said in the account specifics about stacking the review of systems, we only stack the physical exam if subheadings are used. If we wanted the review of systems stacked, we would make mention about it in the course, in the account specifics. Physical exam, a heading was made, and showed is a verb, and so this is a sentence. 126 pounds, again, this is a sentence. Do not start a sentence with a number. You can link it to the prior sentence if possible. Sometimes it's not always possible. If it just started like physical exam, 126 pounds, you'd probably have to go add weight if there was nothing else that you could add. Like if it was just in that circumstance. But you try to add as few words as possible. This person stacked this physical exam, and there are no subheadings used on this one. So if dictated in sentence format, transcribe in paragraph form. So let's talk about the physical exam formatting. And this is all in your account specifics. If dictated in sentence format, and I've added a couple of words in there, with verbs, then you, with no subheadings, no colons, then you just, it's a paragraph. It's just there's a verb, HENT is a verb, is a verb, are is a verb, is a verb, is. All of these are sentences. Just write it, the whole thing goes in one paragraph. No stacking. Now, the other part of that rule says that if dictated with subheadings with colons, and if they all have colons with subheadings, then you stack the entire thing, right? It also says that if you have even one subheading, if it's mixed format, subheadings and sentences, then you still stack it. So basically, if there's even one subheading, you're going to stack that physical exam. And lots of times you'll get down to the very end of a physical exam and they'll say, extremities, there is no pitting edema, and you have to make a subheading, and you have to go back up and reformat that whole physical exam. So just remember, if there's no verb like HENT, eyes were clear, you have to make a subheading for that. Extremities, there is no pitting edema, you have to make a subheading for that. So you have to reformat the whole physical exam. And once you realize that if you use even one subheading, it gets second nature. You just go back and reformat it. It's not that big of a deal once you get to it. Get to understand it. Okay, so this is the corrected copy, and there were 7 protocol errors again at 1.5 points apiece. They add up. Talk quickly about dangerous abbreviations. While we talk about this in the account specifics, they are critical errors if you make them. So if you if dictated QD or QHS, you have to change that to daily or at bedtime. But if Q day, Q week, Q daily, I know that sounds weird, Q month, Q nightly is dictated, transcribed verbatim, that is going to be your protocol error right there. It sounds weird. Each, Q is each, and day is like, it doesn't matter. If that's what they say, and many dictators will say that, then just make sure that you are transcribing verbatim. It's QD and QHS that needs to be changed, okay? And there is a blurb in there. CC has to be changed to ML. You know, there's a dangerous list for you in 931-932. Okay, let's do another one. On physical exam, the patient is well appearing. He is in no apparent distress. His vitals are normal. HENT is normal. Neck is supple. Chest is clear. Heart is regular. Abdomen is benign. Extremities are normal. Okay. This one, the person stacked, made a heading and stacked. And it just needs to be one paragraph. This would be 2 protocol errors with duplicate errors. You don't want to stack it. The patient is, and you can't understand, year-old female. The first time I saw the patient was last week when she presented with a 3-day history of nausea, vomiting, and diarrhea. She has been, I spelled like there's an error. She has been on no medications and she has no allergies. She said, I can't stop throwing up. I can't keep anything down. Okay. Let's see. They transcribed the patient is, of course, the no asterisks, and don't make comments down at the bottom. And also, it's a good habit now not to say things like, you know, use a bunch of question marks that when you get frustrated and can't hear something, or you know, make a note at the bottom like the doctor is stuttering, or can't make out this doctor, he doesn't talk well. You know, don't make comments, because some of these comments can end up at the facility, and you just don't want to ever say anything that might get back to them. I mean, I know you're in school now, but you just don't know. And you don't need to make you don't need to add can't make it out, because a blank that's what a blank signifies. Okay, so the first time we use ordinals, so you always want to use an ordinal. 3-day, you want to, all the numbers need to be typed in Arabic format, so that those are 2 right there. Okay, let's talk about this one. This was written in one sentence for your, she has been on no medications and she has no allergies. New paragraphs should be formed for every major section of the report. And even though this is written and dictated as one sentence, you need to make 2 paragraphs for this because you need to have a section for medications and a section for allergies, even if no heading is dictated. So drop the and just make 2 complete sentences. And you will see this a couple of times throughout the course. It's a protocol failure because you have to make a new sentence. You have to make a new paragraph for that. Okay, on this one, they spelled out cannot, and it needs to be, it's in the first person, and it needs to be put in quotations and kept in contractions because it's a direct quote. And while we're talking, I don't know why I threw this in there, but times, if you've been seeing you have to use X to denote times, but the rule is basically if the number comes before times, you want to use the X. If the number comes after the times, then you want to spell it out. So if it's dictated times 1, it's times 1. If it's dictated 1 time, then use the number 1 and then spell out time. That was just in there. And also capitalize the first letter of immunizations. Basically on this, if shot or series or immunization follow flu or shingles or hepatitis or any of those, if it represents a shot, then you are going to capitalize that. And more information on that on 19.2.2. So there were 5 protocol failures at 7.5 points on that. All right. I think we're getting close to the end here. Okay, vitals show a blood pressure of 110/80. Temperature was 36.0. HENT, eyes were clear, lungs clear, heart clear, extremities normal. Labs showed a hemoglobin of 13.0, a hematocrit of 28.3. The patient will be given a prescription of 0.125 milligrams of levothyroxine. She will be referred to the endocrinologist. Okay, so hope you all can pick some things out on this one right away that were done incorrectly. If dictated, the 0 on labs, measurements like vital signs, you need to transcribe them. Especially lab values, they want those to a T. If they say something is 13.0, they want that noted. You cannot do that with drugs because that's very dangerous. But with labs, measurements, BMI, you want that if dictated. Don't throw a 0 in there if it's not dictated, but you want to do that. Same way with before. If it's less than 1, you need to denote that with a 0, because even if the doctor didn't dictate it, if that little decimal point can be missed, and somebody could think 125 milligrams. There are a lot of checkpoints nowadays, but you don't want to take a chance. So if it's less than 1, you always want to add that 0 in. And this is in your account specifics. Spell out a 0 if it's used as a general, there was 0 tolerance, things like that. Levothyroxine is a generic drug. Again, just takes a second to throw that into RxList or drugs.com or somewhere and look. She will be referred to the endocrinologist. Specialists are not capitalized unless there is a named or scrubbed information in front of it. So there would be 4 protocol failures on that one with some duplicates for 6 points. This is the last one. Patient has a history of Parkinson's disease. Diagnosis of Parkinson's disease, asthma, and diabetes. Plan, we will start the patient on Sinemet POQ day. Okay? So let's talk about eponyms very quickly here. Parkinson's disease. It's an eponym. It's named after a person. If it's used as an adjective, okay, so here, this is if the noun follows, don't use the apostrophe S. If no noun follows, use the apostrophe S. Patient has Bell palsy. Even if it says the patient has Bell's palsy, you still write Bell palsy. Parkinson disease, Alzheimer disease. Even if they say it frequently, Parkinson's disease, doesn't matter. You drop the apostrophe S if the disease follows it, if the noun follows it. No noun follows it, you put the apostrophe S on the end. And that information is in your account specifics also. Diagnosis, they didn't number. You always number, whether it's they number them or not. You always have to do that. That's another 1.5 points. Sinemet is a brand name drug. You have to look that up. And Q day, that's they transcribe daily. That has to be transcribed verbatim. There'd be four protocol failures on that one. So I hope you understand and see that these do matter. At 1.5 points each, protocol errors add up and bring your average down. And I think frustration comes from not understanding these rules. And once you gain an understanding, transcribing is so much easier. Well, at least that part of it is. And if you have this many errors, it leaves a little room for any other errors. And I think, in conclusion, I hope you can see that account specific errors are costly and can really deduct points from your report. Again, we all know that punctuation is important. You know I've done webinars on punctuation, but I want to encourage all of you to focus on the bigger picture here. Points do matter in this course. Accuracy matters. Doctors will care if you format their reports correctly. It does matter to them that you follow the rules that they have put in place. It matters more to some than others, trust me when I say that. Again, these rules are put in place for a reason, and I would encourage you to please spend time focusing your attention on these rules. I know that once you do this, your reports will not only become more accurate, you'll be able to sit down and transcribe your reports without the chaos in your head about headings, stacking, and all of those other formatting questions. These rules really are well laid out for you in your account specifics. And I would encourage you too that if you don't understand them, please ask the instructors. And I hope you see that once you spend a lot more time focusing on these, your grades will definitely improve. And I really appreciate everybody coming today, and I hope that this has helped clear up some of your questions about account specifics and hopefully put more emphasis on maybe spending more time with them. And I hope you enjoyed it. Oh, thank you, everybody. Thank you so much. I really appreciate you guys coming today. Thank you. If you have questions, be sure to ask if you're not sure about any of it, okay? Thank you. Oh, good. That's good to hear. Oh, thank you, Zuma. Thanks, Christine. You're welcome. Glad you came.